Hello guys, this is Dr. Palnepan Manikam. Today we're going to talk about the report in Norway where 29 patients died after giving Pfizer COVID-19 vaccine, and many people were actually very anxious about it. I read through the YouTube comment section, so I thought I'll just make a quick video regarding what is true, what is not, is this of a real concern to us? Let's dive deep into it. So Norway, similar to all the other countries, approved Pfizer vaccine for COVID-19 prevention. And similar to other countries, they started the rollout in high priority individuals, including nursing home residents. First, we need to understand what a nursing home is. So nursing home is a place where actually they have patients who are very sick, who are usually 75 plus, terminally ill patients, in patients where the medical care cannot be given at home or they don't have enough support at home. So all these patients will be having their medical care in nursing home. So unfortunately, Norway does have high number of nursing home residents, and 400 people die every week even before the COVID-19 vaccination in this patient population. So the cause of death could be, because of advanced heart disease, advanced lung disease, cancer patients, terminally ill patients. So the cause of death is multifactorial even before the COVID vaccination. So when you look closely into these 29 deaths, most of these patients were in comfort care or hospice, which means that because of some serious medical problem, their anticipated duration of life is only 6 months, which the cause could be like cancer, or they could have like stroke, or they could have like advanced heart or lung disease, which makes their lifespan less than 6 months. And these patients are called as comfort care or hospice care, which means that these patients are so sick to start with. So when anybody gets any vaccine, mild side effects like fever, nausea, diarrhea is expected within 24 hours, which means that the immune system is working. But unfortunately, since these patients are so sick to start with, even a mild temperature of maybe like 99 degrees or even like a mild diarrhea, their body could not tolerate it. If the same vaccine would have given to like a young 40, 50 or a 60-year-old patient, or even a healthy 80 or 90-year-old patient, this would not have happened. I personally have seen 10 patients who are 85 plus who got vaccinated last week and did not have any allergic reactions, and they are doing great. So if we thought that they could not tolerate the side effects, why should we give them in the first place, right? The reason is, if we don't give the vaccine to these patients, if they get COVID-19, they will die right away because they are so sick, right? And they are living in a nursing home. If one patient gets COVID-19, it will hit every other patient, and the whole nursing home we all will see is just death. In addition to that, the clinical trial participants who were 80 plus in Pfizer trial did not experience any significant side effect either. So it's a catch-22 situation. If we give the vaccine, some patients might not tolerate it. If we don't give the vaccine, the whole nursing home residents might experience significant complications from COVID-19. So the government decided to give the vaccine to these high-risk nursing home residents. So we still don't know what exactly happened, whether vaccine really caused death in these patients or was it because of something else. So research is going on. I think it is too early to come to a conclusion. I'm just concerned that all these reports are creating unnecessary anxiety in patients who are actually willing to take the vaccination, especially younger patients. I don't know whether future elderly patients will tolerate the side effects, but I just cannot tolerate this media hype. I saw a report which says that European Pfizer vaccine kills 29 innocent people. Day, terrorist madri pesringalada. So there are going to be multiple reports that's going to come out. Oh, vaccine caused this, vaccine caused that. The most important thing is how common is this across the world, and whether vaccine is really related to the reason for the problem. See, I had a patient last week who had a vaccine, got into the car, ended up getting a road traffic accident and broke his arm. And now he's saying that vaccine caused the arm fracture. And he's claiming a lawsuit against Pfizer. இந்த Pfizer காரங்களை பார்த்தா ரொம்ப பாவமா இருக்கு. So it's absolutely important to know whether the complication is coincidental or is it really caused by the vaccine. It's almost similar to my mom saying, அந்த பூனை மட்டும் குறுக்க ஓடாமல் இருந்துச்சு வச்சுக்கேன், நீ கண்டிப்பாக 12th physics examல சென்டம் வாங்கிருப்படா. So all we're asking from a medical community is just trust the science behind it, and just remember that we need 70% of population to get vaccinated to come out of this pandemic. So we are trying to do everything possible from our end to create awareness and to educate as much as possible. இதில் விட்டா டான்ஸ் வேறு ஆட சொல்லுவாங்க போல. So don't believe everything what the media says like breaking news. It will just break your confidence. Just get the information from trusted sources. So one of my nurse in California, he got his vaccine last week. He's from India, so he knew about the Covaxin and Covishield approval. And he wrote a Facebook status that Bharat Mata ki Jai, Jai Hind. I'm proud of Indian scientist. He got the UK-based Pfizer vaccine. Vande Mataramnu sollitu vaccine matrain. I appreciate your questions in the comment section. I will try to clarify as much as possible. Please also let me know what topic to cover. Stay safe. I'll see you in the next video. Bye-bye.